Good morning, everyone, and welcome to Great Day Houston. I want to give a shout out to all the people I met at the Community of Faith Church with Bishop James Dixon this weekend. I've received a number of nice awards in my lifetime, but this was a first. The name of the award is She's a Bad Kingdom Sister. Bad meaning good in this case. Joining me on that list was Whitney Ray, Shantae Johnson, Dr. Ruth Simmons, Kim Roxy, and Rosemary Tucker. All of these women are doing great things to make Houston an even better place to call home. They've done all kinds of things from funding entrepreneurs to feeding the homeless and serving as inspiration for those who are battling life-threatening diseases. I was so honored to be with you yesterday. All right, there were so many great events to experience in Houston this weekend. Did you miss out again because of tired, achy legs and didn't want to go from pants to shorts because of bulging veins? Many people think it's just a sign of aging, and age can have something to do with it, but our first guest says you don't have to live with it. Dr. Tony Reincke with Reincke Vein Center joins us with the latest technology to easily and quickly correct the problem. Good morning.
Good morning.
All right. So this is literally the case. So many people are covering up their legs and missing out on events because their legs are just a big problem for them. And so many people are misdiagnosed. I mentioned earlier that they think it's a part of aging. I just have to live with it. I'll just deal with it. But really, a lot of people are misdiagnosed, which points to the importance of going to a specialist like you.
Yes, ma'am. Absolutely. So I think one of the things is that people think that they just need to live with it, like you said, like it's a normal part of aging, or maybe that they were misdiagnosed. Some of the skin changes, swelling, etc. People think that they have more of a skin condition or an arterial issue, and it actually is a venous problem.
Yeah, a lot of people will put off getting evaluated because they don't know what that means. This is a really quick process. You're good at doing this, and a non-invasive process.
Yes, it's quick. They're in and out the same day. I do all the procedures myself and they're back to their normal activities.
The problem for a lot of people too is they put it off because they remember they may have a mother or father or grandparents who went through what's called vein stripping back in the day, which you witnessed was a long, arduous process. It's not like that today, but go ahead and explain to people how you saw that before, which is kind of what led you into doing what you do today.
Yes. Well, I used to be a surgical ICU nurse. I worked in an open heart unit. Occasionally we would recover just for a short period of time. Those patients that had the vein stripping procedure required general anesthesia, operating room, and then a 6-week recovery time. Now, as a physician, I'm an interventional radiologist. Patients are in and out, back to their normal activities the same day. There's no downtime.
All right. With vein disease, it's common with men and women. Are there people who are more prone to it?
Absolutely. So obesity, age over 50, an occupation where you sit or stand a lot, multiple pregnancies, obviously for females. Those are probably the biggest risk factors.
We mentioned a couple of the symptoms, but what are some other things that people need to keep in mind that might say to them they need to come in because it could be vein disease?
Okay. Night cramps, restless legs, heaviness, tired, especially at the end of the day. Those are some additional skin changes, bulging veins.
And generally when somebody gets this treatment, are they treated for good, or is it something that's kind of a maintenance thing that they might need to see something else done maybe a few years later?
That's a great question. And a common misperception by patients is that they think it's one and done. It's absolutely not. Vein disease is treatable, but it's not curable. So something that we educate our patients on, even if you're treated now, in the future, you may need other veins treated.
All right. What about cost? That's the other thing that stops a lot of people from seeking help.
Understood. So we always check with patients' insurance. We do take most commercial insurance, Medicare, Medicaid, and we tell patients up front before they even get an ultrasound what any out-of-pocket costs would be for them. Then once they get the ultrasound, same thing. We develop an individualized treatment plan and we would tell them. We also have payment plans if that's necessary.
Yeah, I've spoken to one of your patients and she said, I couldn't believe that I put it off for so long and the procedure was so quick, so easy. She was done before basically she realized that she was even getting it done.
Yes, I love that. That's my goal. Absolutely.
Yeah.
I take a lot of pride in that.
Yeah, and you also take a lot of pride in making sure that the patient is at ease with everything. You make yourself available to them. They have your cell phone number. You walk them through it. They have any questions. You do all of that before and after.
Yes, ma'am. Something that I think makes us unique is the amount of time. I see every patient, every visit. I do all the procedures myself from start to finish. And like you said, every patient has my cell phone number. So even if it's just peace of mind, they can text or call me anytime.
Yeah, and Dr. Reincke, this is just one of those things that you can try to put it off, but once you have vein disease, it does not get any better until you get it treated.
That's correct. So kind of what I tell patients, depending, they're symptomatic and they're able to get treated, getting treated sooner than later is the best thing for them to do. Yes, ma'am.
All right. Well, thank you very much.
Thank you. Congrats on your award yesterday, by the way.
Bad Kingdom Sister. Thank you very much. All right. Reincke
Okay.
Vein Center has a special offer. Mention Great Day Houston to receive a free consultation. Call them at 281-394-4446. Again, that number is 281-394-4446, or visit their website at ReinckeVeinCenter.com. At least find out in that consultation if vein disease is actually what you're dealing with, so you can go ahead and take care of that problem sooner rather than later.